Hi, everyone, and welcome to the podcast. My name is Andy. I'm the clinical lead here at ReadyCare. And in order to mark World Diabetes Day, we're going to talk about what diabetes is. So we're going to look at what's known as the pathophysiology of type 2 diabetes. We're also going to talk about the science and where it's at in terms of its treatment. And I'll just give you a quick look at our own results here at ReadyCare. So we would pride ourselves on being leaders in the treatment of type 2 diabetes, certainly from a lifestyle intervention point of view. So with that, we'll get started. Okay, so first of all, let's just talk about how type 2 diabetes actually happens. Essentially, type 2 is carbohydrate intolerance. Now, what I mean by carbohydrate intolerance is an intolerance to, or you could frame it as an allergy to, bread, rice, pasta, cereals, potatoes, bananas, and so on. Those kind of high carb / high sugar foods. So what happens when you eat something that's carbohydrate based, and this is everyone know, not just type 2 diabetics, is your blood sugar levels trend very high. So eating carbs, digestible carbs, means that's turned down to sugar in your blood. All carbohydrate, by the way, is metabolized as sugar in your blood. Your body has to produce a lot of insulin. The hormone that does that is known as your pancreas. And essentially, to kind of simplify it and break it down in an easier way before we get into the science of how to treat it, type 2 diabetes is where your pancreas becomes tired and no longer efficiently makes insulin to push glucose into the cells where it can be used for fuel. So what happens in the case of type 2 diabetes is you get these high blood sugar levels and you get a lot of insulin production. Now, when the pancreas gets tired from making insulin, it kind of breaks. But instead of breaking and not being able to make insulin, it makes way too much insulin, which has lots of other knock-on effects. And your body starts refusing to respond to signals of insulin. So basically, your body makes loads and loads of insulin. The good analogy there is like an accelerator braking in a car, but instead of going backwards, it brakes and goes forwards. The pancreas is kind of broken. Your body is making loads of insulin, but your body becomes what's known as insulin resistant. So it stops responding to signals of insulin, meaning that you've got loads of insulin. In fact, you've got way too much, but it can't get your blood sugar levels under control. So your blood sugar levels stay really high. And the damage in diabetes is caused by not the disease itself, not in the sense that you've been diagnosed with diabetes and as a result you're going to get all the small blood vessel damage. It's uncontrolled diabetes. Lots of diabetics who go on lower carb diets and stay in them for 20 or 30 years will have more or less little or no extra damage compared to somebody who's normal glycemic or not diabetic. So type 2 diabetes is caused by high blood sugar levels, your pancreas producing lots of insulin, kind of breaking because it can't keep up with the insulin demand, and your blood sugar levels get out of control because your body is not responding to insulin accordingly, or how it should. Now, this is really interesting, or at least I find this super interesting. If you look the right way, you can spot type 2 diabetes happening at least a decade before you actually see it in HbA1c. So just to backtrack a little bit, you'll have heard of blood glucose levels, like your sugar levels being 6 or 7 or 8. And if your fasting blood glucose levels are sugar levels are 7, you're probably pre-diabetic. If they're fasting and they're higher than 8, you're probably diabetic. But the gold standard for type 2 diabetes diagnosis, at least, is something known as HbA1c, which is hemoglobin A1c. Now, hemoglobin, just to explain it, is when sugar goes through your blood, hemoglobin is a binding protein that attaches to the sugar. And when the sugar is long gone, you can actually check. You can't check the sugar because that might be 10 today and 4 tomorrow if you haven't eaten. But if you check the hemoglobin, because it's a binding protein that's a good proxy for how much sugar has passed through your blood, it gives you a 120-day or 4-month average of how sugary your blood has been. So your blood sugar control. So for that reason, it's considered the gold standard. And that's what your doctor will use to say whether you're non-diabetic, pre-diabetic between 42 and 48, or diabetic above 48. Below 42, for context, there is normal. So HbA1c, interestingly enough, is kind of the last one to arrive to the party when you're becoming diabetic. So what happens is you'll start seeing your blood sugar levels will trend a bit high, but because your insulin levels will creep up very high over time until your pancreas breaks, you mightn't actually spot the high blood sugar levels at all. Insulin might be doing its job, keeping it under control until it's not. And what I mean by until it's not is until the pancreas breaks. But the high insulin levels will usually cause you to have weight around the midsection, high blood pressure, low HDL, which is good cholesterol, and high triglycerides, which are a bad cholesterol or fats going through your blood. So this is a really interesting paper that showed about 10 to 15 years before the diagnosis of type 2 diabetes, and long before you get pre-diabetic or your blood sugar levels go up, your insulin level will be high. So that kind of begs the question, why are we not checking insulin levels? And that's a whole nother podcast. But basically, it's a good one to know. Now, you'll know if your insulin levels are high because typically, again, you'll have weight around the midsection, low HDL, high triglycerides, high blood pressure. And the answer to that is low carb to lower your insulin levels. So if we look at how we treat diabetes at the moment, we've got about 26, 27 million people in the States who are currently diagnosed with type 2. You could argue there's probably closer to 100 million with diabetes and pre-diabetes. If you look at, there's at least double the amount out there undiagnosed, and you've got just a huge volume of people with pre-diabetes as well. I think they made an estimate there recently from a cohort of a couple of thousand people, and they reckoned probably 50% of individuals in the States are either pre-diabetic or diagnosed or undiagnosed diabetic as well. And if we look at this, of the 26 diagnosed diabetics who are in the States, all of them are on medications. It's very rare, maybe 1 or 2% that refuse to take medications. They all go on medication, yet the number keeps on creeping up. And this is just, I say this to illustrate the point that medicating type 2 diabetes is just masking the symptoms. It does not get rid of the disease itself or put the disease into remission. So if we look at what type 2 diabetes is, if we take a step back, we can kind of reverse engineer then and at least suggest a possible way of treating it. Type 2 diabetes is carbohydrate intolerance. So I saw this really good picture recently. I should have put it on this podcast actually, but it was a doctor having a conversation with a patient. And this is not a reflection of how every doctor works, but it is a lot of the time. And it was a doctor saying to a patient, you've got a disease that's caused by your diet. And the patient says, oh no, should I change my diet? And the doctor says, not at all, here are some pills. And it's a really good illustration that that's the way we currently treat chronic disease in what's known as the allopathic or Western way of treating chronic disease, is just medicate the symptoms. Where what we should really be saying is you have carbohydrate intolerance, we need to change your diet and get rid of processed foods that will put the disease in remission. So this is what we mean when we say it's carbohydrate intolerance. So if you have brown or white rice, either or, there's a slight difference between the two, not enough that we should all be eating brown rice in large volumes. Porridge or oatmeal, as our Canadians call it, brown or white bread and potatoes, they're all roughly 9, 10, all the way up to 14, 15 spoons of sugar in your blood. Because again, all dietary carbohydrate is metabolized as sugar in your blood. Whether you're diabetic or not, you are eating sugar when you eat carbohydrate. And this is what happens with diabetes. This is essentially the problem, is that those large volumes of carbohydrates convert to sugar in the blood, and then they cause small blood vessel damage, because in the instance where you're diabetic, your pancreas can't produce enough of that hormone insulin to lower your blood sugar levels. You have sugar bounding around the body, and it causes damage, or what's known as glycation, in the small blood vessels. So you'll notice with diabetics, they always see problems in stroke in the small blood vessels in the heart, poor wound healing, ulcers, amputation in the fingers and toes and feet, and damage to the small blood vessels in the back of the eye, the retina, which is known as retinopathy. And that's a process that happens known as AGEs, advanced glycemic endpoints. So basically the endpoints where sugar builds up and causes, in a sense, rotting, as crude as that terminology is. So how do we reverse this damage, or how do we at least stop it getting any worse and put the disease in remission? Well, we have to apply the principle that all type 2 patients will see very high blood sugar levels when they eat carbohydrates. So we need to dial down your intake of carbs, in particular refined carbohydrates like granola bars, cakes and pastries, but also bread, rice, pasta, breakfast cereals and starchy vegetables. And we replace these foods with foods like meat, fish, seafood, full fat cheese, eggs, butter. And just as a very quick kind of a comment on this, the idea that saturated fat clogs up your arteries or eggs might give you high cholesterol is just not true. It's not supported by the objective empirical clinical literature as it stands today. Green vegetables, good fats, all of those foods, and that will help put your diabetes in remission. And we say this with confidence, and we consider ourselves experts in metabolic health because we have run trials, we have our own studies where we've shown a 48% reversal or remission rate, to use the correct terminology, in type 2 diabetic patients in just 8 weeks. In the 16 weeks, you can do potentially higher numbers than that. We've published our results in, I think, 10 or 11 journals, many of them international journals like the European Society of Cardiology and the American Heart Association. So guys, hopefully that's giving you a idea as to the kind of the landscape of type 2 diabetes, how it happens, the pathophysiology of it, how you can treat it, and what the results look like at the moment. We wanted to do this to mark World Diabetes Day. If you haven't already, guys, make sure to subscribe to our channel, and thanks for joining us. Take care. Bye-bye.